So germs are all around us. They are in our surroundings, on other people, animals, and frequently we get infections by having these germs transmitted via our hands to our eyes, our nose, and our mouth. And these are sites where germs find easier to enter the body and cause infections. Now, growing up in the community, we are told to wash our hands frequently. This enables us to wash off those germs with soap and water and prevents us getting sick. In healthcare facilities, the stakes are even higher. The germs in these locations may either be germs that were so bad that they caused people to be so sick that they needed to come to a health facility, or these may be germs that might be resistant to our treatment, so other patients in the health facilities being treated, and these germs are able to overcome those treatments and spread to other patients. So cleaning our hands in healthcare facilities becomes something that is really, really important. Healthcare workers can clean their hands when they are visibly soiled by going to a sink and washing with soap and water. But when they are very busy, alcohol-based hand sanitizers are more convenient, such that after they've come in contact with a patient, they quickly clean their hands and then move on to the next patient. But the challenge is that alcohol-based hand sanitizers are expensive and they are not usually widely available. The WHO has created guidelines for the production of alcohol-based hand sanitizers. In using a local formula, people buy ingredients and then can manufacture within health facilities. And hospitals have used this as a model to produce enough alcohol-based sanitizers for their own facility. And we've been very, very privileged to have an opportunity to work on this project for the last 3 years with CDC. We came up with a model where the district, rather than the health facility, produces the alcohol-based hand sanitizer. Not only do they produce, they are responsible for the quality controls, and then they can distribute this to all the health facilities within their geographic area. The beautiful thing about the WHO formula is that it can bring down the cost by as much as 45%, meaning that more facilities can get to benefit from the alcohol-based hand sanitizers. And this is an important measure that we have used to strengthen hand hygiene, particularly during the COVID-19 outbreak in districts that we have supported.
It provides for a very essential and a very handy opportunity to improve hand hygiene.
When this alcohol production unit was created, we actually saw an increase from about 3% to 55% in terms of hand hygiene using the sanitizer. So we are really grateful for this production unit, which was actually put at Bukuku Health Center 4.
And this was also readily available in all the facilities, including the PNFPs and the PFPs. This is where we thank IRC that came in to collaborate with us, collaborate with IDI, to increase the number from 31 to 54 facilities.
Sanitizer was produced in Bukuku. They would bring it at the district stores. So I would do quality checks to see whether it conforms with WHO standards. And after, we would organize for the distribution to healthcare facilities. And it really greatly improved on the accessibility.
With more support from the CDC's Global Health Security Program and the Division of Foodborne, Waterborne, and Environmental Diseases, IDI expanded the alcohol-based hand rub production model to the Kasese district to support Ebola prevention and preparedness efforts in December 2019 during the Ebola outbreak that spilled over from the DRC to Uganda.
As Kasese district, we have been working with IDI since around 2019, when we had the Ebola cases in this district, we started working together with them on IPC, including the production of alcohol-based hand rub that has really supported our health workers.
This started during Ebola, but that one assisted us in also transitioning from Ebola to COVID-19 because we're using same principles of IPC and we're able to move on well because by the time COVID came in, we were all well equipped with the sanitizer. We had built capacity with the production of the sanitizer.
During the COVID-19 pandemic, the project continued to scale up to improve hand washing and ABHR use to border districts as a contribution to prevention to HAIs, including the COVID-19 pandemic.
As you well know, the truck drivers and other people from the neighboring country pass through Tororo before they go to other places. So we had a very high risk of infection among our people, and therefore we needed to take precautions.
IDI as an organization came up with a production unit at Tororo, and they helped us with the buffer stocks for the sanitizer. So this has been of help, and it has been bridging the gaps of stock outs of sanitizer, and also has improved on our infection control at the point of entry.
The project has covered over 15 health facilities. We're also taken the project up to the community members, the churches, the markets, mosques, schools.
IDI gave us washing facilities. IDI keeps giving us sanitizer, and we have dispenser bottles from IDI, and each time we run out of the sanitizer, they keep telling us to come and pick more. So since then, we have never run short of sanitizer. It's always in stock.
Using the CDC PopCap Toolkit, 91 high-priority locations in both districts along truck routes were identified and supported with ABRH and hand-washing stations.
We can now eliminate common hand-transmitted conditions because every healthcare point we have a dispenser for this sanitizer, and since we produce it, we replenish the supplies regularly, and we also to distribute to other health facilities and markets in Tororo.
IDI basuplyingira nze nange nengabira abakatale, ngabira abamaduuka sanitizer gwe batuwa ne sabuni liquid soap, ne batuwa ne washing facility, so bituukira mu nze nange nenkola ki nengabira ba vendors nabo ne bawa ba customers baabwe. Washing facility tugiteeka wabweru awo, ayingira mu katale yanaaba mu ngalo.
We have noticeably seen reduction in infection of common infections like common flu and diarrheas among children.
In August 2021, the project extended to Karamoja region with production units established in Moroto and Kotido, targeting 41 health facilities.
Before they came in, we used to have a lot of stockouts of sanitizer, yet that was the period when the COVID-19 was at its peak. As I speak now, we have not run we have not had stockouts of sanitizer.
I have mine, and other colleagues of mine also have. We are able at least to sanitize when we are seeing our clients in the unit, and also the lower facilities are able to access ABHR.
This sanitizer was mainly produced to help people in the facilities, but I can say it has only not helped the facilities, because as schools opened, we were able to give even to some schools who are not really able, their budget could not handle purchasing of the hand sanitizer.
As a role in the facility here, we do the preparation. After the preparation, we actually send it to the main store at the district. Then from the main store, it's actually the facilities that now request from the main store and actually takes it actually that side of the facilities.
18 ABHR producers trained, 6 production centers established, 178 health facilities were supported with ABRH and hand washing stations. Other locations included 10 markets, 4 worship centers, 7 schools, 7 border points of entry, 12 hotels and lodges. Over 45,000 liters of quality-controlled ABHR have been produced and distributed. The project has reached over 800,000 beneficiaries. This project also received the Gold Award from the Infection Control Africa Network, Africa.
As we all know that the supply from the National Medical Store is always not adequate. Now, when it is made locally within here, it really improves on the availability of this unwrap to the general health facility in the districts.
Government should take leadership in ensuring that these initiatives of improving hand hygiene by providing locally produced alcohol-based hand sanitizer to healthcare facilities is procured centrally in terms of the materials produced maybe at the district level, as we have been doing for the past 3 years, and all healthcare facilities, government, private for-profit, private not-for-profit should all be included and should benefit from such initiative, because health covers everybody and nobody should be left behind.
We are requesting Ministry of Health and National Medical Stores to include the ingredients of sanitizer production on the cycle, especially the alcohol that we use, distilled water, glycerol, so that if these raw materials are included on the drug supply list, it can be easy for us to get them from the facility. We get them at DHO's office, and we do the production and distribute to the health facilities.